have any issues to attend the demo means you can able to check there also. And I hope most of them who all are shared your details. I share the application access. You people seen that application access. You people reviewed that application access. Everyone got your application access. In case
we installed and we can able to access.
Case if you are having any issues, end of the session I can able to show you how to use that and where the materials are there and where you people can able to see all the details as well. Everything I can able to show you end of the session. So please stay on that line. Okay.
Okay, sir.
Screen font size is fine for everyone, or else I need to still maximize. It is fine. Font size is fine for everyone.
Yes, it's fine.
Okay.
Yes, fine.
Okay. So I hope most of the people are joined. Okay. So every end of the session, I can able to share the materials like that. I can able to share the chat box until you people are going to be copy that. Okay. So until you can able to listen what we are going to be explain the thing. So first of all, we are going to be start that. I hope most of the people are attended yesterday's class, right?
Yes, sir. Yes, sir.
Yes, sir.
Most of the people attended our yesterday's class. Okay, fine. Got it. Just a second. Okay. So yesterday I said that lot of departments are there, lot of specialties are there in that one. So today we are going to be know about that, like what are all the types of codings are there. Already you people are experienced, but some people are experienced, some people are freshers. Okay. But even though I'm going to be explain about like in the little bit whatever I know that. Okay. Okay. So fine. Today we are going to be see about like inpatient department. So first of all, we are going to start about like inpatient coding department and outpatient coding department. First, we should know what are all the things comes under into that inpatient and what are all the things comes under into the outpatient. Just we need a clarity on that. So we have a lot of confusions are there in the people, like which one is inpatient, which one comes under outpatient. Why I need to know the difference between like inpatient and outpatient. Like this kind of confusions are there, even though if you are experienced or a fresher. So first of all, I will be clarifying that what is outpatient department first. Later we'll go with that inpatient. What is outpatient? Normally, what is called outpatient? When we will call outpatient? When we will call outpatient?
One day
report.
patient, same day, like morning he came and 1 or 2 hours and he went like.
Yeah, just the patient came to the hospital and he taking the treatment or consultation and X-ray, whatever it is, he returned back to home. That is called outpatient, correct? So in the outpatient, lot of specialty coding departments are there. So just we are saying you are a OP coder, but OP coder itself having different types of OP coders are there. ED coders, E&M coders, radiology coders, laboratory coders, therapeutic department like rehab coders, outpatient coders, observation coders, like that lot of specialties are there. So these and are all the things I'm going to give you just a hint. Just hint I'm going to be given you. Okay. So first we are going to be see about what is emergency department. So what is emergency department? What is emergency department? Then we will call the emergency department.
Patient will admit in emergency.
When the
If he is
patient came to the
severe
hospital for
patient
emergency
may-
department and
Yeah, it is admitted severe. That time we
that time it is comes under emergency department. For
emergency.
example, the patient came to the hospital. For example, he ride on the bike and suddenly he fell down. What will happen? Some lacerations will be happen and immediate treatment he required. So he came to ED and what ED they will do? Some simple repairs, some simple procedures and all everything they will do. And later the patient discharged to home. And suddenly the patient having spike of the fever and the patient came to the hospital and taking the medications and returned back to the home. That and all comes under into emergency department. Coding, ER visits, procedures, physician service. In ER visit also they will do procedures. In emergency department also they will do the procedures. So we need to be consider the procedures as well. So we need to code outpatient also we will code the procedures and outpatient also we can able to code the conditions and all the ER visits can be reported here. Okay. Next thing is ambulatory services. Just a second, Tim. I'm getting continuous notification. I'll switch off the notification and I'll come. Just a second. Okay. So the next thing is ambulatory service. What is the meaning by ambulatory service? What is the meaning by ambulatory service? What is ambulatory? What are all?
Outpatient. Like
Yes,
same day
outpatient.
surgery.
Surgery, yeah. Ambulatory means surgery, yeah. There is a
Same day
two things is
surgery.
there.
Mobilization.
Yes. So the procedures performed without overnight stay or otherwise ambulance coding is there. Ambulance coding is there. So that is also comes under into that category. Next thing is radiology or imaging. Radiology means just the patient came to the hospital for to take a X-ray, CT, MRI, ultrasound. So there is a radiology coding. Radiology also comes under into the outpatient department. Next thing is laboratory services. Laboratory services means pathology, blood test, diagnostics, lab workup. This under also we have a separate coding department is there. So that and all comes under like pathology coders, laboratory coders. This kind of coders are there. That is also comes under into outpatient department. Next thing is therapy services like physiotherapists are there. They are giving like occupational therapies, speech therapies, multiple therapy types are there. So that and all they will be giving you in the outpatient department. That is called therapeutic department codings. And outpatient clinics. Outpatient clinic means individual physicians having clinics, right? Individual physicians having the clinics. So that kind of department also the people are coding that. That is comes under into OP coding. That is also comes under in that category. And next thing is observation department. I will be explaining that observation as well with good examples and later we can see. Observation means for the short term, I need to monitor the patient because if the patient came to the hospital for abdominal pain, by the 1 hour evaluation, I can able to say what is the reason for the abdominal pain. It is possible. Within a 1 hour, I can able to say this is the reason for abdominal pain and particularly migraine.
No.
Particularly migraine. Even though if the patient came to the hospital for migraine, we are unable to confirm that. So at the time, I need to be make a monitoring to the patient. I won't give any treatment. I want to confirm that what is the reason for the migraine? What is the reason for the abdominal pain? So at the time, I can't able to admit the patient. I can't able to return back to home also. So I need to monitor the patient. So that's why I move to observation unit. So that also comes under into the outpatient departments, observation coding. And infusion chemotherapy codings are there. And apart from the preventive care, diagnostic procedures coding, this under also comes under into the outpatient department. So that under also we need to be know that categories. It's clear, team? It's clear. This under all outpatient. So without admission, what are all the things the people are doing? What are all the treatments they are taking from the hospital? That is comes under into outpatient department without admission. Without admission, these all are comes under outpatient department. If you want to become outpatient coders, you people are able to can able to work in this any one of the specialty. So that people called us like outpatient coders. Second thing, we will be come up with that inpatient department coding. What is inpatient department coding? Departments are comes under into inpatient. I hope outpatient departments are you people knows very well by from your friends or by your things. You people can knows very well about the inpatient departments. Sorry, outpatient departments. Correct. Your friends may be working and your other things are working. Everything you people knows very well. But inpatient, anyone knows inpatient also having department. Anyone knows about that? Inpatient also having some department. Yes. No. Okay.
If patient have facing any life-threatening condition like
Mhm.
sepsis, that
Mhm.
time patient have to
No,
admit
I'm
in a
not saying
hospital.
about like inpatient like that. I'm asking how outpatient had having some specialities like different kind of specialty coding. Now, inpatient also we have some different type of coding is there. That's what I'm saying. Inpatient also having. Yes. So the first thing is what is inpatient?
Where patients get admitted to the hospital.
Mhm.
Patient staying staying after 24 hours
Where
What is
the
inpatient?
treatment can't be managed at home.
is very complex clinical treatment.
Okay. So inpatient means the patient stayed more than 24 hours in the hospital. Correct?
Yeah, yes.
No.
Treatment.
Okay, so more than 24 hours. And then any other how we can define inpatient? Because this is one of the important interview questions may they ask in if you are attending the interviews. What is inpatient? Okay, so more than 24 hours. Yes, if the patient stayed more than 24 hours in the hospital, it might be a inpatient coding. There is a rule is there. And other than that, how we will define it is inpatient?
Data service also will consider the discharge summary and admit date also.
Should we stay into calendar day?
Without? Without? I'm not understand, sorry. Okay,
Admit
fine.
date and discharge date also will consider.
Mhm. Okay, so I will give you one example and just could you please confirm that whether it is inpatient or outpatient? Okay, so just I will give you one example and later we'll go for an detailed explanations. Okay. The font size is fine or otherwise I need to make a little bit bigger. It is fine.
Yes,
Fine,
fine.
sir.
If you are seeing mobile, maybe it will be a little bit difficult. I will try to maximize. Okay. Okay. So this is what is the type of visit? What is the type of visit?
Outpatient.
ED.
Outpatient.
Outpatient. And I will give you some instructions. If I mention PT means that is called patient. Okay. I don't want to write bigger than okay. PT means patient. DS means discharged. And DX means diagnosed. Okay, so DX means diagnosed. So just you can remember the short terms in PX means physician. Okay, so just remember that.
PDX means primary diagnosis.
No, not PX. I'm not saying PDX, just PX. Okay. Okay, so physician, just you can remember the thing because sometimes I'm not writing completely. Okay, so now this is the thing. Is there any doubts or any questions are there? The patient came to the hospital for abdominal pain. In ED, physician treated with the medication and pain result after 6 hours. The patient discharged to home. It is outpatient visit. Correct? No doubts. Okay, so the next question. What is CPR? Any idea about CPR?
Cardiopulmonary resuscitation.
What is the type of visit type this is?
Inpatient.
Inpatient.
Inpatient, outpatient. Just read it slowly. The
Inpatient.
patient came to the hospital for cardiac arrest. In ambulance,
Inpatient.
they did CPR. After resuscitation, transferred to ICU for further care. And again, the patient had cardiac arrest. And after 4 hours, the patient expired. So, OP or IP?
But more
OP
than
visit?
24 hours is observation.
No, whatever it is, you can able to share your answers, and I will let you know once
It's OP,
whether it
sir.
is
In
it is
inpatient.
OP, sir.
inpatient. Okay, you can mention your answers. I can able to understand your thoughts. I can able to understand your things, whether it is inpatient or outpatient, and how it will be. OP, IP, IP. Okay, so it is interaction session team because now so the learning phase will come out because at the time if you are, I told you right, I can able to understand your language, whatever you are going to speak, like multiple languages. So try to speak with that, no issues. This is the learning base. If you are asking any doubts without anything, I can able to discuss with you. But if once you enter into the office, they won't respond. Even though if I'm in office, if you are asking any doubts, I won't respond. I won't respond clearly. But if you are in the training phase, I can able to respond your answers because you are in the training duration. But once you entered into the office, no one ready to explain in the detail way. So try to make more questions to me, and whatever I know, I can able to discuss, and whatever I have the idea, I can able to share with you. Okay, so fine. First of all, OP uses. Why you people are choosing this is OP? I need a rationale. So it's not like inky pinky ponky. Answers should not be like that. I need a rationale. Rationale means why you choose that. You are choosing one thing, right? You are
Time
choosing one
period
career.
is less than
Okay. So
time
Less
period.
than
stay
24
stay is
hours.
less than 4 hours. Okay, fine. I agree.
Yes, sir.
Then inpatient. Some people are choosing inpatient. Why it is inpatient?
Based on the provided document.
Based on the provided document. Okay, so which
Transfer
document meets?
ICU.
This
Okay,
is
so ICU,
concerned
transfer to
critical
ICU.
care.
Okay. So all the transfer to ICU can I consider inpatient? All the ICU can I
No, but
consider
they
in?
planning to admit the patient.
The plan is admit. Okay, so good thought. Another any other suggestions? Any other suggestions?
This is critical care. This is critical care services, I think. Inpatient.
Inpatient. The answer is IP visit. I will be explaining in by understanding way. I will be explaining in the understanding way. So how I can able to explain now? For example, one of the patient came to the hospital and he taking the treatment in the ED. How much he will spend? If the patient wants to take the treatment in ED, max to max, how much he will spend? How much he will spend in the emergency department? 5,000,
2 to 3.
5,000 rupees, whatever the condition it is, max to max 5,000 rupees they spend in emergency department. Correct? If any minor surgery also like laceration repair, suture, reduction, whatever it is, 5,000 to 6,000. Correct? They can spend. But if the patient wants to admit, what is the minimum charges for ICU admission? What is the minimum charges for ICU admission per day?
More than 10,000.
More than 15,000 as of now. In here I'm staying in Hyderabad, it is like more than 15,000
Yes.
for private hospitals, minimum 15,000, and apart from that all other charges are extra. All other charges are extra, whatever the devices they are used, like catheter also they are charging separately. Only ICU charges is 15,000. So if I am an outpatient coder, if I'm an outpatient, I can able to spend max to max 5. But if it is ICU, I can able to spend 15,000. Now, if I think it is an outpatient, I completely coded and I send it into it is a outpatient account. I submitted into the insurance company. The charges is 15,000. If you are an insurance company owner, you will pay for 15,000 for outpatient services.
No.
If you are out, if you have insurance company manager, you are an insurance company manager. One of the person was came along with that, like I have a claim for outpatient visit for 15,000 for 4 hours. You will pay. Okay, your claim will be perfect. Claim will be passed. Like that, we will do that. It's possible. Not possible.
No, it's
Not
not.
possible. They have the certain restrictions are there. It's not possible. But if I mention that this is the ICU charges for 15,000, what you will do? You will approve. If it is an ICU, like inpatient visit means you will be approved, because without admission, first of all, they will move to ICU. The logical thing. Without admission, is it possible to move the patient into ICU? Because ICU itself, if you did the admission only, they will do the ICU placement, right? You need to first sign the admission form. and after that only they will take the patient to ICU, correct? So when the physician
Yes.
documented like ICU, the patient is in ICU, the patient moved to ICU, the patient admitted to the hospital, that is comes under inpatient, irrespective of the hours. Got it, team? This is the first issue the people are facing in the interview. How you will identify it is inpatient? The people are saying like more than 24 hours it is inpatient. The people will be rejected. Because we know the time is, there is no guidelines like that. The time meaning is inpatient. The time makes inpatient. There is no type of rules are there. If you see anywhere, there is no types of rules are there. If the patient should be more than 24 hours, there is no rule is there. It depends upon the physician documentation. The patient admitted to the hospital after 5 hours, the patient expired. That is inpatient visit. That is inpatient visit. Got it, team? So there is no time limit for the inpatient category. So that you should be remember very well. So that is the difference between the learning. That is the difference between the learning. So if I'm going to directly take the ICD guidelines, PCS guidelines, live chart completed, then what is the use of that? End of the day, you know the concept, but how to apply? You don't know what is outpatient, what is inpatient. How you will be identified? This is your chart, right? If you are working in one queue, if you are working in the one queue, one software will be there, in the one queue is there. Sometimes mistakenly outpatient account will come in inpatient bucket, inpatient account will come in outpatient bucket. But if you don't have an idea how to differentiate whether it is inpatient or outpatient, if you coded everything, what will happen end of the day? Going to be, this is also you don't know, like that one question will come from your TL, correct? So that's what I said, that fundamentally it takes time. So some people will think like why the classes are not started, why these things are going on, whatever it is, we won't hear these kind of words. We won't hear that. Our class, our schedule will be like that. First, the people should know the fundamental. If you are joining inpatient also, you should know what is observation. You should know what is outpatient. You should know what is ED, what is E&M. That and all you people need to know. At the time only, we need to know about complete thing. So you should start from A to Z, not in between. You should start from A to Z. That's what I'm saying. If you are an experienced coder in other specialty, if you know very well ICD, sir, I have a CCS certification, whatever you know, I'm going to be start from the scratch only. Because this and all other trainers won't be explained, because other trainers don't have any exposure about this kind of live thing. Because we know that we are working with the clients. Got it, team? It's clear. Okay, so some CCS candidates are there. Yesterday I hear that like I completed CCS, even though I need to go with that. So this is new to you or it is? No, I know that. This is newer thing. How did you people think like that? New things did you people are
New
learning,
one.
right? Okay, fine. Thank you. So that is the thing. There is no time difference are there. There is a lot of forms they are following. 1000 CMS 1400, 1450, like this kind of forms are there. That detail and all I will be sharing with you the PDF that one. So based on that physician documentation only, the character of the patient, the character of the documentation, the set of the thing will visit type will be decided by the documentation. The physician says the patient got admitted. This is inpatient visit. Okay. So the next I'm going to give you one of the simple scenario to understand that. What is the type this is? What is the type
Outpatient.
this is?
Outpatient visit.
In outpatient, which kind of
Outpatient.
specialty? In outpatient, which kind of specialty? Any idea? It is outpatient. Yes, I agree. It is outpatient.
Oncologist.
Consultancy.
Consultation,
Oncology.
evaluation and management or consultation. Oncology, consultation. So now you people are having an idea, right? How I can understand the documentation, how I can, that's what I'm saying. I'm giving lot of example instead of giving that what is consultation, what is visit. I don't want to go with that like that, the terminology by the PDF. Why I'm writing now, the same wordings you people are going to be seen in the documentation. Patient came to the hospital for regular consultation. The patient came to the hospital for cardiac arrest. So the day one itself, you should be understand the diagnosis. That is more important. And again, I'm going to give you one more simple example. Tell me whether it is inpatient visit or outpatient visit.
Inpatient observation.
Inpatient observation. Inpatient observation type is there. Observation coding, I know. Inpatient observation, outpatient observation, like that departments are there. No, I thought no.
No.
Okay, so first of all, what is the type? This is outpatient or inpatient?
Outpatient visit, outpatient visit.
Outpatient. Outpatient or inpatient?
Inpatient visit.
Confusion again. I give you confusion.
Outpatient.
Inpatient.
Outpatient, sir.
Outpatient. Why it is outpatient? The patient stayed more than
Outpatient.
40 hours in the hospital, right? He crossed more
No,
than 24
not
hours,
like
right?
that.
Not
There is
admitted,
not
sir.
results
So
are
after the results
the
came
results
to
only
negative,
came
sir.
after
Okay, so after
4
the
hours.
results came as negative, so that is outpatient observation. Okay, so I got something, and again I will give you one more question. Okay, OP visit, exactly it is OP visit, and the departments are observation department. The same question.
Bro, why it's outpatient visit? I don't know. I can't understand.
I will be explain. I will explain.
Okay, bro.
I will explain. No issues. Okay. So read it. The same question. Just I change the hours. Let me know whether what is the type this is. I didn't make any changes. Everything is same. Ultrasound, stool test, blood test, everything is fine and everything is correct. And after 50 hours, all the results are came as negative. The patient discharged to home. Whether it is inpatient or outpatient. I didn't make any changes.
Outpatient. Outpatient, sir.
Outpatient.
Inpatient.
Inpatient. Outpatient. Okay, fine. It is. I hope everyone having phone or someone connected with that like a laptop or something else. Just type what is 2 midnight rule and read it and let me know. Any one of the people are explained. I can able to make it correction. What is 2 midnight rule? This is one of the important interview question in all the inpatient coders interview. What is 2 midnight rule and read it and let me know.
2 midnight rule is a Medicare guideline
Okay.
defining when a hospital stay qualifies as an inpatient admission versus Out
Hmm.
observation outpatient based on the physician's expectation that the
Hmm.
patient needs medically necessary care spanning at least 2 midnights.
Crossing to midnights.
Midnights.
To midnights. When the patient crossed 2 midnights in the same hospital, that account, the software automatically converted into inpatient, even though if the physician didn't say. Before I said when the physician says it is admission of inpatient account, but there is another rule is there when the physician document without physician documentation, if the patient crossed 2 midnights in the same hospital, that is also inpatient visit. There is a rules is there. There is a guidelines are there. That's what I said. We don't have any proper definition to define what is inpatient. Now you got it. Now you got it. So 50
Yes.
hours means the
Yes.
patient crossed 2 midnights. If it is
Yes.
after 50 hours means the patient crossed 2 midnights. Correct?
Yes.
Yes.
So that's what. So this is the basic things you people need to be understand. So if you are going to be coding, if you are entered into the coding, you are seeing the chart, everything is negative. The patient stayed only for 40 hours or something else. You can able to say this is observation account. If the patient stayed more than 50 hours, you might be think this is inpatient account. Why it is come to my bucket? Why it is not come to my bucket? So like this kind of thing you should be understand. This 2 midnight rule is one of the important interview questions. Please, you people need to be aware of this kind of questions. 2 midnight rule means when the patient crossed 2 midnights in the same hospital, that is comes under inpatient account. We need to be reported. It is clear, team? It is clear. Now you people have an idea about what is outpatient,
Clear.
what is inpatient. There is no timings are there. It may be documented by the physician. It might be some rules and regulations we need to follow to define the inpatient. Still, I didn't enter into the topic. Just I'm clarifying what is inpatient, how to identify the inpatient account. Now it is clear.
Yes.
Clear, bro. But
Yes, Ma, you can
bro,
ask.
50 hours concept. 50 hours concept, understand, bro. But 40 hours la document due to this patient move to observation unit. Already you said documentation clearly said admit na you consider as inpatient சொன்னீங்களா bro.
Yes, that's what I'm saying. There is a one exception is there. If the patient crossed 2 midnights, even though if the physician didn't document it, we can consider that is an inpatient. That is called 2 midnight rule.
ஓகே ப்ரோ, எனக்கு இந்த இது கான்செப்ட் ஃபுல்லா அண்டர்ஸ்டாண்ட் ஆயிடுச்சு. பிஃபோர் இருக்கிறது தான் அதுல அப்சர்வேஷன் யூனிட் மென்ஷன் பண்ணிருக்காங்க. பட் அவுட் பேஷண்ட் விசிட்டா நீங்க சொல்றது அது எனக்கு கொஞ்சம் புரியல ப்ரோ.
Here also I mentioned observation unit, right? Here also I mentioned
But
observation.
50 hours, 2 midnight
40
rule you
hours
said
means?
la, so
Okay, so just for understanding purpose, I mentioned that 40 hours. 40 hours means the patient might not be
It's
crossed
not
2
2
midnights.
days, no, sir, completely.
It's not 2 days completely. Yes.
Yeah, so it comes under OP only, no?
Yes, it comes under OP only. That's what I mentioned, like observation.
Did you get it?
That's what I mentioned, observation, OP visit. It's not an inpatient account. Even though the patient crossed more than 24 hours also, it's not meeting the 2 midnight rule criteria. Correct? If 40 hours means might not be the patient not crossed 2 midnights. Might be, might not be. We have a admission date and discharge timing and admission timing is there. That and all your software will be calculated. No worries. So just for understand purpose, I mentioned that if the 2 midnights the patient crossed, I will give you one more tip also. 11 p.m. the patient admitted to the hospital. 11 a.m. he discharged in the hospital. He crossed 1 midnight. Got it? Now you got it? 11 p.m. he admitted and 1 a.m. he crossed, 1 a.m. he discharged now, he crossed 1 midnight. We can calculate like this only. There is no time duration. I'm saying that 12 o'clock, in between the 12 o'clock. You got it, ma?
okay bro.
Yes, sir.
Okay, fine. Next, we can able to go with that like inpatient department specialties. I mean, like different type of codings I told you, right? One is acute care coding. Acute care. Another one is Okay. So this and all, we have a different kind of inpatient coding. So everyone knows inpatient coding is there, but inpatient coding also we have different type of inpatient coding is there. I will give you the definition for you. For example, acute care. What is acute care? Anyone having an idea about what is acute care?
Short term,
Short term.
immediate.
Okay.
Acute care means the patient came to the hospital for UTI, pneumonia, COVID, sepsis, fracture. This and all comes under acute care. Acute care means that the acute treatment was given by the condition. Conditions.
Acute
Examples
care
are
and urgent care, same thing.
what, ma?
Is acute care and urgent care same thing?
No, ma, it is completely different. Urgent care is OP, acute care is IP. Okay. So this kind of treatments, acute care means we can able to think like that multi-speciality hospitals. You people knows about like multi-speciality hospital, right? In the multi-speciality hospital, they will treat all the conditions, correct? They will treat all the condition. Sepsis, UTI, pneumonia, COVID, fracture conditions, and apart from that, like neurology, brain tumors, everything they will treat. All the things are acute conditions. Acute condition means the patient came to the emergency department and treatment will be done and move to general ward or specific ward and they will treat. That is called acute care treatment. So most of the 80% of the coders are doing acute care facility. 80% of the inpatient coders are working with that acute care facility. And one more thing, you people need to be aware of that. What is skilled nurse facility, hospice, rehab, long-term behavioral health, obstetric, newborn? Why I mentioned different things and all everything, you people may have doubt. Already I said that multi-speciality hospital. Why he make it like different kind of thing is there now? If you go to that bigger kind of hospitals, they have a separate building is there for observation. Separate building is there for psychiatric department. Correct? Separate building is there for uh,
Yes.
hospice means I will explain what is hospice. Separate building is there for like for children's. Separate building is there for obstetrics. Correct? Same like that inpatient coding also. Some people will do only OB cases. Some people will do only in newborn cases. Some people will do only psychiatric hospitals. Psychiatric codes only they will code. Some people will do skilled nurse facility coding only. Some people will code only hospice coding. Some people will code only rehab related coding. That is also comes under into the inpatient category. That is also comes under into the inpatient category. So these type of codings are there, but actually inpatient coders will do all the codings. For example, my target is per day 15 is there now. I can able to do 12 charts are acute care coding and 5 to 3 charts are maybe hospice coding and 1 or 2 charts are it may be obstetric or newborn or critical access or rehab. Everything I need to code. But each and everything guidelines are different. I will give you the simple example. Anyone knows what is skilled nursing facility? What is SNF skilled nursing facility? Anyone having an idea about skilled nursing facility? What is skilled nursing facility?
Service given
No.
by the nurse.
SNF is
Nurses will
like
treat the condition.
yes.
Yes, yes.
Nurses will treat the condition. So because nurses will treat the condition means there is no acute care not required. The meaning is acute care is not required. That's why the patient is comes under into the skilled nursing facility. For example, why the different is there, sir? I can able to take the treatment in that acute care facility itself, right? There also nurses are there. They can able to treat me like that. Why I need to comes under into SNF care instead of acute care facility? This question will be there. Anyone know the reason behind that? Why I'm already taking the treatment in acute care, but the physician was moved into SNF. Why I need to move to SNF? What is the reason they moved? Any idea?
Like
As per the reality.
like sepsis. If any patient facing sepsis, so that time require active surveillance. So
Yes.
maybe that time require nurse facility.
No, it is like sepsis needs acute care condition, acute care treatment. I will give you a simple example. In the same hospital, ICU also is there, normal bed also is there. You can able to say, I will be staying only in ICU if you have a normal condition. You can able to say,
No.
no, right?
No,
If you
general
have a
ward.
fever, you can able to say, in the same hospital only ICU is there, general ward is there. You can able to say, no, I have a fever, I can treat only in ICU. No, you should not say, right? You won't say, right? Same like that. For example, the patient had a fracture. The fracture surgery was completed. Even though after surgery also, I can't able to go home. I can't able to go home. But even though after surgery, any acute care treatment is required for me.
No, sir.
No. At the time, what I
Yes.
should do? What I should do?
Will-
The physician will
SNF.
move to
They
SNF
move
care.
to SNF.
The physician need to be moved to SNF care. You can stay here. You don't want any treatment. I don't want to see you in face, and nurse will be taken care of you. Just they need to be taken the antibiotic medications. If anything else is there, the physician will come there and treat them.
Any
That
dressing?
is the thing is called difference between acute care and SNF care. Okay, so how I can't able to say I will be staying only in ICU. Same like that, I can't able to say only I will be staying in acute care facility, even though whatever the condition is there. That is the difference between the thing. SNF means they will be treating you your chronic conditions or otherwise to follow up cares. Follow up cares. So their guidelines are different. From acute care to SNF, there is some guidelines are different because acute care facility bed charges is high compared to skilled nursing facility. Correct? Skilled nursing facility bed charges is low. So that's what the physician don't want, because if you already surgery was completed for the fracture, still I need to be staying in the acute care facility now. Compulsory bed charges will be high, right? Compulsory bed charges will be high if you are staying in the same place. So they will be moving into normal ward or general ward or SNF means your bed charges will be decreased. So that's why there is a different specialities they are created, and codings also created and coders also different. Difference is there. Coding guidelines also there is a different guidelines are there. That and all we will be doing by the guidelines wise. I can able to explain that. Next thing is hospice. What is the meaning by hospice? Anyone having idea about what is hospice? Hospice care.
Hospice means palliative care, supportive system.
Everyone watching web
Yes.
series. Everyone watching like medical related web series. No, yes. You people will watch
No.
web series. No, you people don't watch web series. Oh my god.
No.
Fine. No, you should. You can watch, but it should be related to your medical coding related. We have a lot of web series which is related to learn something else about medical coding, like Good Doctor, like Doctor Romantic, and something else is there. So it may be useful for to understand what is PICC line, what is catheter, how they are doing cricothyrotomy, how they are doing bypass, how they are doing like ICU managements on, how they are doing that procedures, what is hospice care, everything they can able to explain in that. Just we can able to understand that. So the thing is, wherever you people are going there, your mind should be captured like what we want, right? That may be helpful to you. So hospice means we have one of the web series is there, like they are explaining about hospice. So that's what I said. Okay. So one of the patient is there. He is having stage 4 lung cancer. Age is 85. I can do any treatment for him, for her.
No.
Age is 85, stage 4 lung cancer.
No.
I can do aggressive chemotherapy.
No.
No.
I can able to take the patient to my home to
No.
take care of the patient. Not possible. So the physician will say maximum 3 to 4 months the patient will stay, and after that he will die. Or maximum within 5 days he will be there and he will be die. So at the time what we should do, the patient move to hospice care. They won't give you any medication. They will give you only the pain medications that is related to that pain medications only they will give you, that the patient won't feel any pain due to that cancer or whatever the diagnosis he has. So later that the patient will die. That is called hospice care, terminally ill patient. So that guidelines also completely different. That is the thing is there, and everything will be comes under into the different category. Next thing is critical access hospital codes. Critical access hospital codes means this kind of hospitals are presented into the rural locations. This kind of hospitals are presented into the rural locations, like we can able to call it like village hospitals. We can able to call it like village hospitals. So same like that, this kind of hospitals also presented in the rural. It takes more time to reach the hospital. At the same time, charges also compared to the normal hospital, it is high. I will give you one example. one of the patient going to the hospital for fever, he is spending 500 rupees in the acute care hospital, but he went critical access hospital, the charges is 700 rupees. Could you please mute yourself, team? Okay, fine. So if the patient moved to critical, if the patient went critical access hospital, the charges is 700 rupees. Here I'm paying 500 rupees. Critical access hospital, then I need to pay 700 rupees. It is worthy. I mean, it is worthy means it is correct. It is correct.
No.
No.
Yes, sir.
It is correct. As per the guidelines, it is correct. Because in the acute care hospital means which is located into the cities, most of the people will go for the city to take the treatment. Rural hospital means whoever unable to reach the hospital, they people only can go for a critical access hospital. So they need to be managed there. They need to be managed the things as well. So that's why it is comes under into critical access hospital charges is little bit different and guidelines also slightly may differ for the inpatient coding guidelines. And next thing is rehab. What is rehab means? For example, the patient affected with a stroke. Think like the patient affected with a stroke. What is the major complications happen during the stroke? After stroke, what is the major complications may happen the stroke?
Paralysis.
Hemiparalysis, paralysis, the patient unable to do. So think like that one of the patient is there, he is working with two hands and walking with two legs, and suddenly he got paralyzed and he is unable, his one leg and one hand is not working. He felt something and he is unable to do their work also. He don't know how to do with one hand and one leg. So the patient after treatment of the stroke, the people move to rehab facility. The rehab facility, they will teach you how to handle with one hand and one leg and how to make it like, because if you are making, if you are not able to do any work in one hand or one leg, it may cause lot of complications like pulmonary embolism, deep vein thrombosis, and apart from that, like some other ulcers. These are also they may able to happen in that paralysis area. So how to avoid these kind of things, they will teach you. They will give you some training, physical therapies, occupational therapy, speech therapy, and they will teach you how to go to washroom. Everything they can able to teach you. That is called rehab. That is also we have different kind of coding is there. Different kind of coding is there. That is called rehab coders. We have rehab coding also is there. That is different type of codings. Next thing is long-term hospital. Long-term hospital means it's not a hospice. It's not a hospice. Hospice means compulsory the patient will expire. But long-term hospital means the patient needs some care. The patient needs some care. He needs to take, like if the patient is diabetes, they need to take a diabetes medication. The patient having some ulcer, one of the person need to be monitored and to dressing the ulcer. So that kind of patient will move to long-term hospital. That kind of patient will move to long-term hospital. That is, we are having different type of guidelines. Next thing is behavioral health. What is behavioral health?
Mental health.
Psychiatric hospital. That you people knows very well. That we know very well about psychiatric hospital. Psychiatric hospital guidelines are little, I mean, as per the guidelines are same, but when you are assigning the primary diagnosis, that will be differ. Slowly, it will be differ. Okay, for example, I will give you one example. The patient had a laceration for suicidal attempt. The physician, the patient was planned to do the suicidal attempt. Due to this suicidal attempt, the patient making a knife and cutting his hand. Like that he documented. So the patient moved to emergency department. The laceration was sutured. The laceration got sutured, and after that, the patient was moved into psychiatric facility for the depression disorder. So if it is an acute care hospital, what is the principal diagnosis? What is the primary diagnosis we will assign?
Laceration.
Laceration. If it is a psychiatric chart, if it is a psychiatric account, what is the primary diagnosis?
Suicidal
Suicide.
thoughts.
Depression, not a suicidal attempt, depression.
Depression.
Depression, because suicidal is just a term. Okay. What is the reason? Due to the depression. So think like that. Acute care facility means different primary diagnosis. If it is a behavioral health, it is a different diagnosis. Now you can understand that the different kind of guidelines. So behavioral health, I can't able to assign laceration as a principal diagnosis because it is not ethical for the as per the guidelines. But acute care facility, I can't able to assign depression as a principal diagnosis. It won't be accepted. Anyone will go for acute care facility for depression? I have a depression, I will go acute care facility. What they will do?
No.
They won't do. They won't do.
No.
So now you can understand the different type of codings are there and different type of coders are there. Next thing is obstetric and newborn. Obstetric and newborn, you know very well. Delivery patient, childbirth patient, and apart from that, like pregnancy, puerperium related, that and all, we have a different type of coding guidelines, chapter specific guidelines. Everything is different. So this is the small things we have in the inpatient coding. Everyone are saying inpatient coding, but inpatient coding also we have a lot of departments. Now you got it. Inpatient coding, just we are saying inpatient coding, but inpatient coding also different type of specialties, different type of departments, different type of coders are there. You don't know after getting in a job, you don't know which department you are going to work. So in case if you are entered into the facility, if you are entered into the job, you should know which specialty you are working, which department you are working. I know everything you people can able to understand in the after within the 1 week you entering into in your office, you can know. But before itself, if you know that, it is very easy to understand the concept. No, at the time I learned this is behavioral health chart, this is a rehab chart, this is hospice chart, this is skilled nursing facility chart, this is SNF chart. So here, anyway, if you are entered into the office also, you can able to learn. But as per nowadays, we have the competition, heavy competition is there in medical coding. Right now, we are facing a lot of heavy competitions right now, it is going on. The thing is, how you are showing your potential, it makes you the better coder. The promotions, the things and all, everything will come as soon as possible to you if you are showing your performance better. Correct? Multiple people are there in the meeting. If you are saying it is this kind of thing, it is this kind of thing, the TL will be noted you, an auditor will be noted you. They will give you some additional preference to you to become a auditor, become a higher position, SME, trainers. So it is the thing is here, whatever you are learning, that it is a base. It is a base because this and are all the things once you entered into the office, they won't teach you. No other auditors, if you entered into the office, if you are, even though if you are a fresher also, they won't teach you like this. Like this means they won't make you, okay, this is rehab, this is hospice. Just they will say this is hospice chart. You should go there, what is hospice and what is the thing and what is why, what is the guidelines are there in hospice, everything you should know that, because they don't have a time. They don't have a time to teach you because they are not getting salary for teaching. Even though if you are enter into the office, your seniors are there, they are paying separately for you to teach that. They are paying separately for teaching you separately.
No.
No, it's not mandatory to them. Some people are there, some few people are there. Few people are there interestedly, they will teaching you your juniors. You, if you are a junior, they will teaching you. But most of the people are won't teach because they don't know that much knowledge. They know coding, but they don't know that much. They don't know knowledge. They know how to code, but if you are asking to explain the chart, they won't explain. They know I10 is hypertension. Hypertension combo code is there. That is the thing only they will do. Once you entered into the office, they are not ready to teach you because you know the politics, right? You people knows very well about in IT. You people knows very well about that, right? Okay, so try to make sure to learn in this period. This is the, if you thinking like just I'm joining the training and end of the training I'm going to do my work, there is no use. And you should learn here, and whatever the questions you have, you should ask. That's what I'm making a lot of Q&A sessions. It is very easy to explain about what is observation, what is OP. Why I'm writing these kind of explanations here. You should learn the terms: ultrasound, cardiac arrest, CPR, emergency department, timings, rules, department. This and all now itself you should be remembered in your mind. You should be remembered in your mind. It might be helpful in your interviews. Compulsory it will be helpful because here itself I told you 2 interview questions. What is 2 midnight rule? What is inpatient? What are all the facilities are there in the inpatient coding? This is the major interview questions are they are asking in the interviews. Okay, it's clear, team. It's clear.
Yes.
Okay, so
Yes, sir.
I will be sharing this thing into in your chat box. Just you can copy because after ending the session you can't able to copy this. The chat box will be closed. I share this text. Just you people can copy it from the chat box. And I hope I informed that to join this group. In this group, I will be sharing the application access because it is individually, I'm not able to talk, given you the application access. So I shared one group link. I hope everyone are joined, right? Once again, I will be sharing the group link. So here you people can join. Still, you people are not received that application access or anything else. In this group, I will be open one poll. Just click there. Our IT team will be connected with you to sort out your issues. In this group, you can join. And before going to end of the session, I will be showing you how to use the application and where the study materials are there that I will be showing you. Just a second.
చెప్పబోతులు మనం
Okay, so everyone can able to see my screen.
Yes, sir.
Yes,
Okay.
sir.
So you people can able to see that IPDRJ January 2026. So here you people can able to see the yesterday's session also recording sessions are uploaded here. If you've seen there, you can able to see the recording sessions of demo session. And later study materials. Here I uploaded all the study materials, ICD study materials. If you click there, you can able to see all the ICD study materials. And apart from that, PCS study materials, all the PCS example questions are there. And apart from that, sample charts. What are all the sample charts are there? Everything, all the charts we are uploaded here. Almost around 100 charts are there. And apart from that, like IPDRG study material. IPDRG study material means particularly inpatient specific guidelines are there. That and all, these are all inpatient specific guidelines, interview questions and POA guidelines, everything we are uploaded here. And later, chapter wise study material. ICD total 22 chapters are there, right? In the 22 chapters, specific separate guidelines are we are updated here. And apart from that, I told you, right? Inpatient anatomy and physiology. Anatomy physiology also we are updated here. Anatomy physiology materials also we are updated here. There you people can able to see. And apart from that, assessments are there. That assessment links I can able to share you in the groups. After enrollment, I will be sharing you the assessment for the practice purpose. So in the study material, everything is there. You people can able to watch. All the recording sessions also I will be uploading there itself. So if you are not, I'm once you join that, I will be opening the poll in the tomorrow morning. If you are not receiving the thing, if you are unable to do that, please let me know. I can able to giving you the, I will be connecting that IT team to sort it our issues. It's clear, team. If you are already enrolled that, if you got already mentioned that, you can do that. And I will be sharing you the application access, how to download. Just you can download this. Okay. Just you can download.
Which app we can download?
You received any message, ma? You received any messages from our end for
No, I
yesterday?
didn't receive any message.
Okay, so yesterday you mentioned your
joined,
mobile
These
number
are
and email
not
ID.
coming, sir.
No, I didn't mention.
You should mention. If you mention that, you will get it.
Okay.
Okay, sir.
Okay, so if you mention there, compulsory you will get it. So please mention your full name and I will be sharing the template once again. So just mention like that and again I will be forwarding you. So who all are done that and already I given the application access. So if you are not there, so just mention there and I will be sharing you the template. So just you can share the same like that.
Okay, sir.
And how did you feel that you people learn something else new or something else already we know?
New, sir. For me, that all new, sir.
It's new. Okay. So I share the format. So in the based on the format, you people can sharing with your messages and I can able to give you the mobile application access. Okay. And apart from that, I hear that lot of inquiries like I can able to do IPDRG with the CCS. What is the formalities? And the formality is the 3 months of IPDRG and last month, 4 month, the IPDRG with the CCS comes under 4 months of training. So the charges is 20,000 if you are ready to go along with that. Okay, so if you are doing separately CCS, that is different cost. But if you are planning to do IPDRG along with the CCS, the total cost is 20,000 and the course duration is 4 months. First 3 months you will learn like IPDRG and outpatient basics, and last 1 month the paper discussion and that along with all the CCS related things we people can able to know that. Okay, so just you people can able to mention your name. Already if you are done, no need to be mentioned again. First time, if you missed that yesterday and you didn't you mention that, you people can mention the details, mention the details. Okay.
This is exam cost also.
Yes, ma.
20,000.
Yes, ma.
This is exam private overall it will 20,000 for exam support.
Yes. 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 And tomorrow is our last demo classes. So try to join that. Tomorrow I'm going to be discuss about like what are all the materials we are going to be study and how to study, and the basic study materials I will be sharing with you tomorrow. Like ICD book, PCS book, and how to handle the book, how to take the quotes from the book, and what are all the things we need to be using that. Everything we are going to be discussed tomorrow. So don't miss the session because that is an important session to go into the next further. And apart from that, I hear that the Sankranti and all everything was came. Whatever it is, Monday and Tuesday we have the classes, and apart from that, Wednesday to Friday we don't have a classes, and we will be starting from next week Monday. So, but next Monday and Tuesday we have the classes. It will be started. We are not ready to postpone more than that. We have started the classes. Saturday and Sunday registration will be going on. Registrations will be going on. So if you want to pay to get the complete access, you can pay this number also. This is our registered thing. You can able to see Jvages Healthcare Private Limited or otherwise AGS Coding Tech. Don't want to pay any other numbers or don't want to pay any other users. If anyone is sharing the scanner to pay, don't do any other annoying things. This is our registered number. You can able to see in the GPay or PhonePe or Paytm, whatever it is, you can able to see private limited account. You will get a bill copy, invoice copy also. You can pay and you can share the screenshot of the same number. No issues. You can able to share in the same screenshot to this number itself. Our HR team will be contacted to you and sharing the bill copy as well. So after bill copy, you can able to moving into the groups of January 2026 and materials, everything will be shared there. And Saturday and Sunday, the registration process will be going on. And Monday and Tuesday, you people need to be join the classes. Different link. In this link will be expired and different link will be given that. It's clear, team?
Yes, sir.
Hello.
Yes.
Yes, please. It is a offline class. Sorry, online classes, ma.
అన్న ఇప్పుడు ఈ క్లాసెస్ మనకి వీకెండ్స్ లో పెడతారా లేకుంటే
It is completely in weekdays, ma, Monday to Friday. Weekend batches are going to be started after Sankranti. We are planning that, but I'm not sure about that one. Timings are 8:30 to 10 p.m. The classes are 8:30 to 10 p.m. Okay.
వీకెండ్ బ్యాచ్ అది డిఫరెంటా?
Yeah, weekend batch is completely different, ma. You people have 4 hours classes per day, Saturday and Sunday. 4 hours, 4 hours, 8 hours classes will be there.
Sir, we have timings for offline.
Offline, as of now, there is no IPDRG classes, ma. Offline, we have started only for the CCS training for the fast track courses. So if you only CCS only we are doing in offline, IPDRG completely online. For the practice purpose, you can able to come to our office and I will be there. And the application and all you can able to use it here, and practice charts, sample charts, shadow you can able to take it from here. And after completing training also, or in between the training also, you people can able to come there. Is it IPDRG class? Yes, it is IPDRG class.
What are the timings, sir, for offline?
For offline, offline means we are available always 10 to 5 p.m. You can come there. Yes, it is IPDRG.
And online,
Harika.
sir?
For online, 8:30 p.m. to 10 p.m.
Daily, sir.
Daily, Monday to Friday, 8:30 p.m. to 10 p.m. Yes, you can come in this weekend. You people can call me. This is my number. You can call me and I will be available to talk with you. No issues.
Okay, sir. Okay.
Okay.
Thank you,
If
sir.
you want to visit our institute, our institute location is Kukatpalli Omni Hospital backside. Just you can come Kukatpalli Metro and call me and I will be there. I will be informing you. Our team will be pick up you. No issues. Omni
Actually,
Hospital.
not possible to go there. Actually, I am staying in Chennai, sir.
You are staying in Chennai.
Yes, sir.
Chennai means online you can continue.
Yes,
Okay.
sir.
Okay. Thank you.
Okay.
Okay.
Bro, doubt, bro.
What, ma?
ப்ரோ இப்போ வீக்கெண்ட் கிளாஸஸ் 4 ஹவர்ஸ் சொன்னீங்களா ப்ரோ? அப்போ வந்து டேஸ் வந்து எவ்வளோ டேஸ் கவர் ஆகும் ப்ரோ?
சேம் டைமிங்
45 days to
சேம் டைமிங் தான். வீக்கெண்ட் கிளாஸஸ்மே வந்து பாத்தீங்கன்னா சாட்டர்டே அண்ட் சண்டேல 4 ஹவர்ஸ் எடுப்பாங்க. ஸோ இந்த வாரம் என்ன கிளாஸ் எடுக்கிறாங்களோ அதை சாட்டர்டே அண்ட் சண்டேல எடுத்துருவாங்க.
ஓகே. அப்போ டேஸ் வந்து 45 டேஸ் கவர் ஆயிடும் அப்படிதானே ப்ரோ?
ஆமா, உங்களுக்கு இதே டியூரேஷன்லயே முடிஞ்சிடும். ஆமா, இதே டியூரேஷன்ல முடிஞ்சிடும்.
ஓகே ப்ரோ.
Okay. Other than that, any doubts or any questions, team?
Sir, any job supporting chestara sir?
Yes, ma, we will do the job support as well. That's what I said. After mock interview, I can able to give you the clear picture. What is the status of you and how can do, which company is able to hire based on your performance, which project is suitable for you, and what is the additional recommendation. For example, after 3 months, training will be completed. If you need any additional assistance, if it is required, I will give you through offline or online.
Sir, age limit based sir.
Age limit, we have tie-up with that 6 companies, ma. In the 6 companies, one of the companies hiring non-certified candidates and non-licensed graduates also. And one of the company is there, that is there is no age limit, but they are expecting they need to do the certifications. So this kind of 2 things is there. Yes, you can attend CCS and IPDRG classes
Almost
without
work
any experience.
from
Yes,
home
ma.
or office bro?
Work from home provided by 2 companies. All other 4 companies are work from office. I'm not able to reveal the company names right now here. And after starting the session, I will be sharing the SOP to you. Okay.
Yeah. PCS exam
Bro, weekend class experience.
Weekend classes?
Weekend class வந்து experience மட்டுமா including fresher bro?
Fresher also, ma. We are doing that. I told you, right? You are a fresher or experience, whatever it is. We are going to be starting from the scratch with anatomy and physiology. Before we are having the different training schedule for freshers, training schedule for experience and all. But later only we know that even though if the people are saying 5 years experience, they don't know how to take the combo course. That is the issue we are facing. That. So that's why we completely changing that our training schedule. Fresher, experience, whatever it is, you should tolerate our anatomy physiology training and ICD training and PCS training and live chat training. So we don't want to compromise to shorten the schedule.
Okay, bro.
Okay, because some US peoples or UAE peoples are said that I have 5 years of experience. Fine, I'm not ready to shrink my schedule. This is my schedule. If you want to know, you can skip the schedule and I will give you the charts and you can do it. You can skip it, but the duration is 3 months. Before 40 days, 45 days we did, but there is no end of the day. We are getting some lot of regret. The people are after attending that interview, they are saying, sir, this topic is I'm not able to remember. I'm not able to understand what is the question they are asking. Fine, what we should do. So that's why we are extended our schedule and the topics will be elaborated and you will getting like lot of information our tool. This is the basic application which we provided right now, and later you people are going to be getting like a different kind of application with a different experience that will having animated surgical videos, surgical 3D animation videos. Everything will be there in the application. This is the temporary applications for you. Okay.
Okay, bro.
Bro,
Okay,
with
thanks.
IP with CCS exam, bro.
IP with the CCS exam, the training cost is total 20,000. You can able to pay every month 5,000, 5,000, 5,000, 5,000. Okay, no need to pay everything immediately. Only 5,000, 5,000. Every month you can able to pay 5,000.
That's examination lo pass అయితే placement available out.
Yes, ma, I will be scheduling that interviews as well. Okay. So just a second, I will close that recording sessions. After that, we'll discuss. Okay, so whatever the